Okay, 68-year-old man comes from Japan several years ago, follows a diet that's traditional salted fish and pickled vegetables, hypertension, osteoarthritis, denying smoking, and an enlarged left supraclavicular lymph node, Virchow's node is noted, and also the blood test is positive. Upper endoscopy reveals ulcerated math and heaped up borders from the gastric antrum. So all this is going to be leading us toward some carcinoma, and indeed, it's going to be dietary consumption of these salt preserved foods. So let's talk about how we know this. So intestinal type gastric adenocarcinoma is commonly presenting with this node that we saw: epigastric pain, weight loss, and early satiety, and a melena. And that's going to be suggestive of metastasis, so the lymphadenopathy. And let's talk about some pathophysiology of these gastric cancers. So there's going to be irritation and inflammation that leads to the metaplasia. Dietary carcinogens, these N-nitroso compounds like processed meats, salted foods, all contributes to the DNA damage. H. pylori infections and autoimmune atrophic gastritis also increase the risk. So here are the risk factors: high salt diets. Anytime you see anybody from Japan, think about the carcinoma. It's on the sketchy as well. N-nitroso compounds like smoked meats and salty foods. H. pylori causes the intestinal metaplasia because of the chronic gastritis. Autoimmune chronic atrophic gastritis, same thing, achlorhydria, metaplasia. Obesity, increased inflammation, and acid exposure. Let's talk about the other ones. NSAIDs produced prostaglandin synthesis, leading to mucosal injury. And so the peptic ulcer disease, ulcers do have smooth, regular borders, and the gastric cancer has heaped up irregular ulcers. So you wouldn't see that smooth stuff like you would in peptic ulcer. Excessive consumption of hot beverages, that's esophageal cancer, strongly associated with esophageal squamous cell. And nothing linked to Japan there. Chronic GERD, so Barrett's esophagus would make us think about that, and that increases the risk of esophageal adenocarcinoma, but not a risk factor for gastric cancer. So yes, esophageal, but not gastric. Zollinger-Ellison syndrome, that's caused by gastrin secreting tumors, this gastrinomas, and it leads to peptic ulcers, but not gastric adenocarcinoma. So Japan, dietary consumption of salt preserved foods. Hopefully this is helpful. If it was, like and subscribe. If it wasn't, let me know how we can improve in the comments, and dislike the video.